Okay, awesome. Looks like we're ready. Good morning, good morning, good morning to everyone. So lovely to see everybody, and thank you so much for joining the Match Coalition. Remember the Match Coalition, Match stands for Maternal Applications of Technology for Community Health. So we are all about innovations, policies, and solutions that are really centered around improving the overall um, outcome of health and well-being for women who are those delivering, who are having babies and helping build families. So we hope to have a fantastic program for you today, filled with lots of great information. And this is certainly an interactive environment, so we do encourage everyone to actively participate. We're also super excited by our presentations that we have for today and quite a bit of information it's going to be shared. I'm just scanning the room right now to see if David Gray is with me, which he is. We're going to be kicking off. So my name is Fran Ayala Somiajla. I'm the founder and president of Reach Healthcare. We are the makers of Happy Mama Full Spectrum Doula Practice and the founders of the Match Coalition. Like we do every third Tuesday of the month, we're going to kick it off with first allowing folks the opportunity to share any updates that they have on programs, events that are going on locally within their community at the state or regional level, as equally at the national level. Does anybody have anything that they'd like um, to share with us? Any big news?
I would just like to highlight an event coming up. The March of Dimes is hosting a webinar on February 27th on self-measured blood pressure. Their new toolkit will also be released at the end of the month. And the panel will include speakers from Baby Scripts, the Preeclampsia Foundation, and Penn's Safe Heart Motherhood program. So we'd love to have you all join. I can share some of the details in the chat.
Wonderful. Thank you, Sarah. What a fantastic program. I equally am a big supporter and fan of that as I'm a member of the board of the Preeclampsia Foundation. So really excited to see this program happening. And please do share information in the link. We'd love to see more folks participate. What a great announcement. Any others out there?
Good morning, everyone. This is Stacy Tuck from AMCHIP, the Association of Maternal and Child Health Programs. I have missed many of these meetings, which I apologize for, and am glad to be here today. I wanted to just reassure everyone and announce that AMCHIP's annual conference is still taking place March the 15th through the 18th. It's going to be right in Washington, D.C. at the Westin, and I can drop more details in the chat about that. As you all are aware, with everything going on, this is a pivotal key time for maternal and child health stakeholders, particularly those involved with Title V, to come together and support each other. So March 15th through 18th, we are on at the Westin.
Fantastic. Thank you, Stacy, and thank you to AMCHIP for keeping the fire burning. Let's keep going. Lots of momentum. Maternal and infant health families is certainly a priority for everyone. And we're glad to see that we're not stopping, that we're keeping going on all of our missions to make for the best outcomes for families everywhere. So thank you for that. Any other announcements? All right, then. David, good morning.
Hey, friend, good morning.
We're going to jump right into legislative updates. Now, don't tell me you're under the weather today.
I put in the chat, daughter is homesick, and I'm taking care of my wife, who's recovering from knee surgery. So just another
It,
day in our household.
that's all right. It takes a village. We're just grateful that you're here with us, and we're excited to hear announcements, updates on what's going on the legislative front.
Yeah, I think we're all kind of waiting to hear what's going on the legislative front. Not a ton to report on Congress, as you probably know. We have a new Secretary of Health and Human Services who's confirmed, Secretary Kennedy. We also are in the midst of for lack of a better word, reforming, reframing, culling, whatever you want to call it, of the HHS workforce. We're not exactly sure what the long-term impact or implications are going to be, but something that we are very carefully watching, especially as it relates to a lot of the programs that impact maternal and child health. And then, any sort of response or oversight that will come from Congress as a result of the inevitable sort of fallout from all of this. But, in terms of some of the things that we are watching out for, looking forward to, federal funding expires middle of March. We're not really closer to a, fiscal or FY25 appropriations or a continuing resolution. We could see a shutdown in March, and we're in the early stages of fiscal year 2026, planning and preparing for FY26 funding. And we're going to be looking at some of the programs and funding levels that impact maternal programs. I also want to note that we are in the final stages of preparing a letter to every member of the 119th Congress. Some of you have already on this call have seen a draft and provided some really helpful comments. Before we get that letter finalized, you do want to send it to the full coalition for any thoughts, comments, or observations. This is an introduction to who the Match Coalition is, and the things that we are working on around maternal health and technology. So be on the lookout for that in the next, hopefully, week or two. Sooner would be better, but and then we want to get that out to our elected officials and start any conversations. That's kind of it for me. Thanks.
Well, that's a lot, David. So thank you so much for sharing with us. I tend to just throw more questions out there, and I think it's fair to say we've seen some dynamic changes, right? Some of them we might even perceive as radical changes. There was an announcement on the national news yesterday that the was it maternal health innovation program through Medicaid, that their workers had been dismissed. That sometimes if we look at this like a corporation, it's not uncommon in a corporation that everything gets kind of torn down first and then rebuilt. So it's like a ripping of the Band-Aid at the moment. And I'm just going to use regular everyday folk language for this because I think it's important that, we acknowledge that. But as David has alluded to, there are opportunities and there is line of sight for some potential rebuild of programs in different ways. So I encourage us all to keep our ears to the ground and keep our, eyes on the target, because I do think, and we do know that maternal and infant health and families are a priority nationally. And so we're looking forward to see what's going to come out. And David, we'd like to thank you for helping us to stay abreast of those dynamic changes as they occur. Thank you for that. Anyone have any questions or comments around legislation or administrative changes that might be directly impacting you at the moment that you'd like to share? All right, so we're going to move on. We're super excited to be able to talk innovation now. We've got some new innovation in the room, and we're super jazzed for that. And I'm also double jazzed, I should say, because I get the honor of introducing you to Kelsey Williams. If you don't know Kelsey, you should. Kelsey is Reach Healthcare's Match Coalition coordinator. So she is really helping to drive this program and bringing a phenomenal lineup of speakers. So without further ado, I'm going to pass it over to Kelsey.
Well, thank you for that, Fran. I appreciate it. Happy to be here. And happy to see everyone this morning. I am excited to introduce our Innovation Spotlight presenter today, Sadie Moore, with Withings Health Solutions. Good morning, Sadie.
Good morning, Kelsey. Hi, everyone. Thanks so much for having me. I'm excited to be here. Awesome. We'll go ahead and share my screen here. Awesome. Okay, can everyone see that okay? Great.
Yes.
Perfect. Thank you.
Awesome. So my agenda for today is I'm going to briefly introduce Withings Health Solutions for those of you who are not familiar with us. We'll chat about what's happening in blood pressure monitoring now. And then I'll introduce our newest device, BPM Pro 2, and we'll talk about how that can benefit care teams, patients, really everyone involved in this journey. So if you aren't familiar with Withings, we've been around for about 16 years when we invented the world's first smart scale. One of my favorite things about this is almost half of those, 45%, are still being used today. Why this is important to us is this is Withings DNA. We want to make devices that are easy to use, people choose to use, and they use them in the long term, because that's really how you ensure that you get that data to care teams, is by making a really easy to use device. We're very proud of our 26 CES Innovation Awards, longtime CES and CTA members. That retention that I discussed, we have 92% after a year. The device industry usually looks at around like 40 to 60%, depending on what their connected device is. So we're really proud to be in the 80s and the 90s with our connected devices. And we have about 15 million users. We've made the Times Best Inventions lists. We're very proud of the DNA that Withings has and the continuous innovation that we've led in the connected device space since we first came to be in 2009. So of course, you'll see here, we do have a range of connected devices, including scales, sleep, temperature, vitals. But what we're really going to focus on today, and what one of our main focuses is as a company at Withings and at Withings Health Solutions, is in blood pressure. So about 5 years ago, Withings consumer brand branched out and we developed Withings Health Solutions, which is our B2B division. This is where we really focus on patients and care teams. You know, patients are consumers too. They also want and deserve a nice looking, easy to use device. And we found that the maternal health space is a very important space to be focusing on blood pressure. Hypertensive disorders of pregnancy are very common. I'm sure all of us here are very familiar with those. And it's a major cause of maternal morbidity. And this has been increasing, which is obviously not okay. And we want to take a stand in what we can do to hopefully help make help more accessible and get your doctor and your patient talking more frequently so that they can find what the best next steps are for that specific patient, or in this case, that soon-to-be mother, and how she can best be cared for. So BPM Pro 2 has 3 main buckets that we'll kind of talk about here, and that's the ability to track your patient insights, your increased reliability of the data that you're getting from that device, and we're elevating that patient experience to make it as easy as possible. So diving into the comprehensive patient insights, what this device has is the ability to actually ask a question right on the blood pressure monitor. So when that patient is most engaged, when they're taking their reading, when they're looking at that device, as you'll see here, it has a nice LCD screen with color, bold text, and these buttons there. They can actually navigate using these buttons to answer questions right on the screen of the device. So these would be questions provided from their care team and customized based on that patient, based on that program, based on where they're at in their journey. So some examples that we have here of what you could use as the questions, or you could do symptoms, you could do medication. As we've mentioned, it's really customizable, but you'll see here an example of how often do you take the medication that you're prescribed. They're able to use the buttons on the device itself, scroll through, and select their option. So these questionnaires are things that are typically being done via phone calls, text messages, in-app. So these are currently interruptions to care team's day. They're having to call and call and call and say, hey, Sadie, did you take your medication? Hey, Sadie, how many hours of sleep did you get last night? All of these patient-reported outcomes are extremely important in order to get an accurate measurement around blood pressure, because it's not just a number. There's also these contextual things such as sleep, medication, other symptoms that you might want to be looking at. You could also have them check in for their appointment right on this device, right? We all know that moms and soon-to-be moms are super busy. They might not see that there's an app notification, but if they're already taking their blood pressure daily, you could use this as a way for them to check in for their appointment, or a way to notify them that they do have a message from their provider in an app somewhere. As we mentioned, super customizable. So any ideas that you guys have for your workflows, whatever bottlenecks your care teams are currently experiencing of manual tasks that they're having to do, we're hoping to make it a bit easier for them so they're able to get more information in advance. We still want them talking to patients. We still want them having those interactions, but ideally they're able to do more top of license activities. And when they are interacting with patients, they're truly providing care instead of just asking survey questions. Overall, we hope that this leads to an improved patient care because you're getting context around the blood pressure reading. It's overall going to optimize your care team's efficiency so that they can hopefully care for more patients and care for them in a higher quality way because they're getting more information, and hopefully, overall reduce clinician and care team burnout because we're optimizing their workflows to be where the patient already is, and that's on the device. Reliability is extremely important in blood pressure. And one of the main reasons why it's not reliable a lot of the time is an inaccurate reading. So what we implemented based on care team feedback and talking to health systems and care teams for months and months and months in developing this device, we realized that when a patient has an elevated reading, typically care teams are calling, trying to find out what's happening, get them to retake that measurement and make sure that that patient is okay. So what we've implemented on this device is threshold-based retake measurements. So there's different thresholds that you can set on a patient-specific level. There's one specifically for expecting moms based on AHA recommendations. And if they have an elevated reading, the device is going to prompt them to take a few deep breaths and then retake that measurement. A lot of the time on that second measurement, now that their legs aren't crossed or they didn't just run up a flight of stairs, a lot of the time you'll get a normal measurement. If it's still elevated, this way the care team knows who they need to triage first, who they need to reach out to, and who is truly an elevated measurement versus just took an incorrect reading. Because blood pressure isn't necessarily easy for everyone. There's lots of doctors out there even that have questions about it. So what we did is we implemented education right on the screen of the device to make sure that they know best practice for taking their blood pressure reading. And we also implemented that education right on the cuff itself. So they can provide instructions on how the cuff should be positioned, where it should be positioned, how tight or loose it should be. So overall, hoping that the advanced education provides more insights for patients to be able to properly take their blood pressure reading, leading to more accurate measurements. We're also taking a deep look at that patient experience. A device is only useful if patients actually use it. And so what can we do to help them use it more? One of the things that we do on our scales and now this new blood pressure monitor is called a health nudge. This is the ability to push a message right to the screen of the device and have it be whatever you want, whether it's a gamification, a reminder to take another measurement, or just a congrats, you did great. We have some examples here of what you might show on the screen of that device, welcome to the third trimester. But this is extremely patient specific based on whatever the program wants to be providing to that patient on that given day. So the idea behind this device is that extreme customization and allowing that care team to interact with the patient without necessarily interrupting their workflows as much. As all of our pro devices are, pro for us means it's cellular. The benefits of a cellular device are that there is no smartphone that necessarily needs to be included. A cellular device actually has a SIM card built right into it, just like your phone does. So you don't need to pair it to your Wi-Fi or pair it to your phone or to your tablet. These patients are truly just opening up their devices and beginning to use them. They don't have to do any setup. So it's really reducing those barriers of entry. And that data is going to flow right to their care team. So they're also instantly viewing that data. Comes in this nice sleek travel case. There's a large cuff option if you have different size arms. Very compact, easy to travel with. So for those care teams, they're able to view that data wherever they're already viewing data. Maybe it's their EHR, maybe they have another platform, or maybe their care teams are somewhere else. You can view the Withings data in all of these places. It's all just integrated via APIs to keep care teams' workflows as efficient as possible and let them view their data, customize the questions that they're sending, the nudges that they're sending, all from their own platform, their own EHR. And then, of course, we do have the Withings RPM platform. If there isn't already a preferred platform in place, we've built this great platform that allows for different alerts and triaging different patients based on their measurements and their feedback. So overall, we're super excited about BPM Pro 2, sort of bringing back the more classic look of a blood pressure monitor, but really embedding a lot of these core features in it that are going to advance the way that care teams help patients by having that two-way communication right where the patient is looking and right where they're most engaged, and then keeping it as easy as possible to use the device to set it up by leveraging that cellular connectivity. So thanks, guys. And I put my email here if anyone has any questions that we don't get answered today. I'm happy to, would love to have more conversations around this and dive deeper into the use cases.
Well, thank you so much, Sadie. And I'm definitely looking forward to all the questions during the Q&A today. I am excited to introduce our next guest speaker, Catherine Pugh, Director of Digital Health at the Consumer Technology Association. Good morning, Catherine.
Hello. Thank you so much, Kelsey. It's great to be back. I believe I spoke at the last Match Coalition webinar, so or maybe 2 webinars ago. So it's good to be back talking to you all. So the last time I spoke, we were in the lead up to CES, which was January 7th through 10th in Las Vegas. And so I just wanted to come and kind of give a recap of the top highlights of the Digital Health Summit this year. For those of you who weren't able to join us in Vegas in January, if you were able to join, we'd love to hear your thoughts and questions about the Digital Health Summit and your experiences during the Q&A period. But with that, I will dive right in, and I just want to go over a couple of things, and we'll leave a lot of time for question and answers. If I can move my slide, here we go. Okay, so if you're not familiar with the Consumer Technology Association, we are the largest technology trade association in North America with about 1,300 members. And you can see a snapshot here. We do not just do health, we do all technology, but our health division is a big part of our membership here at CTA. Most people do know us because we are the owners and producers of CES in Las Vegas, which brings about this year 142,000 of our closest friends to Vegas. And the rest of the year, though, the rest of the 360 days of the year, we are a trade association located in Washington, D.C. I specifically sit in our government affairs department, work a lot with David on digital health policy and others in the space. Here's a snapshot of our health division. I think it is a little unique in that we have a pretty big swath of the healthcare digital health space. We have, your big tech companies that are involved in health, all the way down to startups like Transcarent, Validic, and others that you can see here. Withings, we couldn't fit everybody on this slide. Withings is an active CTA health division member. And it's a great example, as I was saying as we got ready for this, a great example of a company that has really leaned into CES and taken advantage of all of the opportunities that brings. I'm sure Sadie could share more about that. Okay, so the Digital Health Summit at CES 2025, we like to say it's kind of a show within a show because of those 142,000 people. A few hundred to 1,000 are there for health. And we here at CTA organize our digital health conference track, and the overall Digital Health Summit at CES, which you can think of as everything digital health at CES, from our partner track to the show floor to the invite-only events and show floor tours that we do. So just talking about the conference programming, wanted to highlight a couple of sessions here. This year, our health show floor and health conference programming moved back to the Venetian. We've been at the convention center for the past 5 years or so, and we are now co-located with Smart Home at the Venetian to tell that story of how you can live healthy at home, and monitoring as the devices that Sadie mentioned is a large part of that story. Our digital health conference track sessions, we tried to highlight that as well. So we had 12 panels on our digital health conference track, in addition to 2 panels on the startup stage in Eureka Park, which, if you don't know, Eureka Park is also at the Venetian, and that has thousands of startups from across the world that come to highlight their technology and their products at CES. And so the startup stage is down there, and we have 2 health-focused panels, digital health-focused panels on that stage every year that we organize, but we also have a couple of others throughout the show that are partner conference tracks. So a few panels here. We had a spotlight panel, the future of health views from the top, and that was executives from health system, pharmaceutical, Google Health, technology. We also had a panel on health AI in 2030, focused on not just what AI is doing now in healthcare, but what is the potential in the future. And then we also, as we always do, had women's health on the main stage. So advancing women's health, innovations, challenges, and solutions. One of the panels you'll see highlighted here in this picture, that is what we refer to as our cross-industry panel. So we were also talking before this presentation that a lot of people, even if they come for health, what they really like about CES is it's not just a health show. You can see technology and advancements in all other industries. And so this actually is a panel on how technology in other sectors can be leveraged for healthcare. So we have representation from a semiconductor company, from Uber, from Verizon, from the Gates Foundation, talking about deploying technology outside of healthcare settings and in developing areas. And so this is a really cool panel that I thought I'd highlight for everyone, to highlight that all tech comes together at CES. And I also will say this link here, all videos, all panels are online right now, ces.tech/discover. So even if you weren't there, you can catch up. So I know this is a maternal health group, but I think it's actually really cool to highlight how much the women's health category at CES has grown. I will say, this has been my 3rd CES. We saw a lot of technology in the maternal health and fertility space when I first joined. But this year, the real big takeaway from the show was tech for menopause and perimenopause, and there were a lot of different products. I had one news story here that's highlighting that. I just thought was like a great example of that was a big takeaway from the show floor this year. So Sadie mentioned that Withings was a CES Innovation Award winner for the past, 26 years or something. I don't know that's how many years that was. It was 26 awards. I don't think it was 26 years. But this year, I wanted to highlight a couple of our other Innovation Award winners. So the Eli Health Hormometer, that's a hard word to say, is an at-home hormone testing device. And then also another Innovation Award winner in the women's health space, Peri, which is an AI-enabled wearable device that accurately detects and tracks perimenopausal symptoms. And there is a few other companies on the show floor. Ember Labs, which is thermoregulating wristbands. And then there was a company, Starling Medical, that had a urinalysis system tracking UTIs and other health indicators. So I thought this year, the story and the real takeaway was perimenopause, talking about women's health, not just in that one snippet of time, not that it's not important, but that one snippet of time that we are focused on fertility and maternity. So just a couple of slides here that we're putting together of what people are saying about the Digital Health Summit at CES. We have attendees you can see from across the spectrum of payers to providers to venture capital, all coming together at CES and helping make the Digital Health Summit a success. I just wanted to end with a couple of overall slides on the Consumer Technology Association, because like I said, CES is just a very small snippet of what we do. We do have members like Withings that are technology companies. And as a part of that, being a member, you do get CES benefits, which I've listed here. You do get a discount on exhibiting at CES. You also, if you're a member, anybody in the company receives unlimited free registration to CES. I will say a lot of the conference program that I've talked about today is on a paid track. So you do receive a discount on our deluxe conference passes too, which would ensure that you get to attend any paid session across CES. And you also have access to the CTA member lounges. As you can imagine, with 142,000 attendees, it can be difficult to find a place to sit and get water and beverages. And so that is a great perk for CES. But we also do events throughout the year. So this is a highlight of our 2024 events. We were really happy to partner with Congressman Troy Balderson's office and Congresswoman Rhonda Kelly's office to launch the Congressional Digital Health Caucus last year. We'll be continuing to work with them. We also have a lot of events focused on AI throughout the year. And this is just not just AI, but health at home as well. We recently launched the Health at Home collaborative, FDA collaborative community with the Digital Medicine Society. We'll be continuing our work there, which I'm sure is of interest to a lot of you. So this is just a snippet of our work, our association side work, not just the CES work. And then the last thing I wanted to highlight, I think this is the last thing, is that, we are a trade association. So generally you have to be a for-profit technology company to join CTA or a nonprofit. We have a nonprofit category for health systems that are providing healthcare, but we didn't really have a good way for nonprofit associations to work with CTA formally. So this year we formed the Health Technology Partner Program that allows for associations to formally partner with CTA and formally participate in some of our work, including our standards development work. CTA is a little bit unique in the trade association space in that we are an ANSI accredited standards development organization. So airplane mode on your cell phone, closed captioning, all of those are CTA standards. We like to say that there's not probably a piece of consumer technology that's not touched by a CTA standard, but we have more than 30 digital health standards, including a women's health technology standards work group right now that is working on publishing their first women's health standard later this year. Oh, so I think that's the last slide. Yeah, thanks. So that was a lot to cover, but I'm happy to answer any questions, and I will stop sharing my slides now.
Thank you, Catherine. With that, perfect transition. We're actually just going to go ahead and open the floor for our Q&A. So if anyone has any questions of Catherine or Sadie, please jump in.
Well, Kelsey, before we jump into those questions, a big thank you to both of our presenters. Amazing presentations and very inspiring. I just think back, I can't even remember I'll be dating myself publicly to say how long ago I became involved with the CTA and participating in programs ran by the CTA and attending the annual conference. So thank you so much for providing us that overview of CES from this year. And it's not only for those who may have missed it, but also for those of us that were there. There's so much that goes on at CES. I have to go back and on occasions and look at the sessions that I missed because there's so many. There's so much of everything at CES that it really it's very inspiring. But there's you can only attend so many things simultaneously. So you have to pick and choose. So to know that there is the on-demand version of the program available, please do. If you're interested, take advantage of that. A lot of very rich content. So thank you. And now that we are going into the Q&A session, I would like to maybe point back to Sadie for just a second. To talk a little bit more about what you have done with your technology. I admired how you pointed out the integration of education directly into the device itself. And as you were speaking, it drew me back to what we often see in maternal health, where an expecting individual is, their blood pressure, they might be suspecting preeclampsia or other complications with heart-related conditions. And the expecting mom, is asked to get a blood pressure monitor. And the first thing, as our doulas would say, is, well, did you get it? Have you taken it? And, do you know how to read it? And kind of walking them through and making sure they know how to actually use the device correctly. What inspired your team to decide to integrate this educational component directly into the device?
Great question. And yeah, I think it's one of those things that Withings being on the forefront of innovation, inventing the first connected scale, inventing the first connected blood pressure monitor, we're always looking for how something can be done better as opposed to just repeating what's already being done. So our product teams, our client support teams, really everyone at Withings spent a lot of time talking to providers, care teams, health systems, clinicians, the people that are actually doing the job, the people that are actually viewing the data, and chatting about what's going wrong, what feedback are they hearing, where are they seeing a breakdown in communication, and that's really where all of those new features came from. But the education component specifically is really important because blood pressure isn't just as easy as stepping on a scale. There is a lot more that goes into it. If your legs are crossed, if you're talking during your measurement, if you just, I guess in this space, they probably shouldn't be smoking cigarettes, but it's a common one that we see in other spaces. There's all of these indicators that will end up leading to an elevated measurement. And it puts their clinical care teams on high alert. They're calling, they're concerned, and as they should be if it is a true elevated reading. So trying to find a way to filter out those false elevated readings. So if you take your measurement incorrectly, it's going to be elevated every single time. That's just the science of blood pressure. So it's very common to get an elevated reading just because you're talking, your legs are crossed, you just ran up a flight of stairs holding a baby on one arm and you're 8 months pregnant. Like there's so many things that can make that elevated reading. So providing that education right where they're already looking at the device, reminding them not to talk, reminding them to uncross their legs, just makes it a little bit more accessible for people. It's one less scary thing. My doctor just sent me home with this device that I don't know how to use. They're telling me I might have an issue with my baby. It's scary. So let's try to make it as accessible and understandable to that end user as possible. So from showing them how to take the measurement on the screen to retaking it if it is high. And then we give color-coded feedback in green, yellow, red in terms of what that measurement means. We're not all doctors. We don't all know what that means. So kind of getting to get a view of, we all know red, yellow, green, sort of where it's ranking based on those AHA protocols, can sort of give them some more ownership of their journey and trying to get that reading, from red to yellow to green, if that's their case.
How wonderful. As you were sharing, it brought me back to the reality that most clinicians don't take the time to educate their patients about how to use a blood pressure monitor. If they need to go out and get one, they tell them to go and get it, but no one pauses to give them that last mile information that's necessary to get accuracy in the data. And so it's really very impressive that your team has incorporated this more comprehensive approach to ensure that we're getting great readings. And of course, as we know, high blood pressure is a concern, but so is equally low blood pressure. So being able to provide those insights equally is really very, very good. And we're excited for what you have created and looking forward to seeing more people adopting the use of the technology. As I think about, okay, you use the word connected a lot, and it, kind of brings us back to the early heydays of remote patient monitoring when everything was about the Bluetooth enabled capability. And we realized that that was actually creating sort of really creating sort of a hurdle, right? Is a cell phone working? Do you have a cell phone? There was debates around data plans and, people not wanting, people who are using devices that were being given to them through subsidized programs, not wanting to use their devices, their mobile devices for health purposes, like all of these things. So I just really like the way you've sort of cut through that. But of course, with every device then having a SIM card integrated into it, embedded inside of the device, then there are other regulatory elements that come up and best practices that we need to consider more broadly when it comes to, telecommunication and the internet and networks. So Catherine, you had mentioned when you were speaking about some of the best practices, some of the committees that have been designed around, various core topics within the field of technology. Do you mind sharing with us a little bit about some of the perspectives and things that you have seen that your committees are working on as it pertains to ensuring the connectivity, ensuring the encryption of the data as it's being transported, security and privacy around these sort of connected devices?
Yep, absolutely. So I will preface with saying that we have a fantastic team on the standards development side. I am not one of them, but I can pretend to be for a little bit. So yes, so I think where we see industry standards playing a role, as you mentioned, Fran, is regulation plays a very important role in ensuring safety and efficacy of devices. However, we do recognize that there is a middle ground between, setting baseline safety and efficacy requirements and then ensuring products work as they are intended. And there are, industry standard best practices in terms of technology development that ensures consistency or security across devices. So one of the good examples that we have is actually our first digital health standard that CTA published, which was our standard on step counting. And so the industry, our members, saw that there was all of these new wearables coming on the market to track physical activity, except for, as we probably all realized when we were first adopters, that there were wide variation. It's like I'm walking with my friend all day. She's got like 6,000 steps and I've got 10,000 steps. Why? And so one of the first standards that we published was standardizing, what is a step between all of the step counters. Obviously, that's not something that really needs to be in federal regulation because it's not directly impacting safety of a device, and in terms of efficacy, it's not an FDA regulated device. It's not really providing a medical intervention. But the other example I'll give of that is that CTA was really involved in advocating for over-the-counter hearing aids for people with mild to moderate hearing loss. So that is a category at the FDA now. People think like all over-the-counter things are not regulated, but that's not true. The FDA actually has a pretty high criteria for regulating over-the-counter devices and what you have to do in order to market your product as specifically as an over-the-counter CGM or over-the-counter hearing aids. And so CTA developed the over-the-counter hearing aid standards that are referenced in the FDA final rule. So companies have to comply with those standards in order to market themselves as an actual over-the-counter hearing aid. And so those are just some examples of what our work groups are working on. There are other working groups, like I mentioned, Women's Health, that are publishing their first standards that's looking into more just general use cases of technology in women's health, and then getting more specific from there. So we try to be responsive to what our members are working on and what their priorities are. I hope that's a couple of good examples. But I'll put the link in the chat to all of our standards if people are interested in looking further into them.
Those are great examples. You're so right about the pedometers. I just remember, like, people would sit and shake their leg, and that would would make for an increased count. And I'm like, no, I don't think that qualifies. Yes, just shaking, the hand on the leg and shaking the arm, just like they're just sitting at a desk. Okay, that doesn't work. This is great. Wonderful.
Yeah,
Well,
riding like
thank
a bumpy train.
Yeah, exactly. It's like, but you're both of you, right? Both Catherine and Sadie are both getting your counts in for sure, because you're over at 5 today. So that's pretty awesome and fantastic. Does anyone have any questions for our amazing guest today? Any questions? What is the timeline? What does it look like when you take a process through validation? Like, I know, Sadie, that some of your earlier devices are validated for pregnancy. This device, fingers crossed, might, although, as we all know, most doctors don't pause to say, get a validated device. They just want you to take your blood pressure. So I'm just going to put that out there right there. But I would be curious to know, like, what does that mean? What kind of effort has to go into that? Any insights on that you can share?
Yeah, absolutely. And this is, I think, a really important topic in digital health right now. And, a main reason why I'm so excited to see CES, for example, taking such a larger shift, even getting more and more into digital health. We're very proud to be going to CES and see a rising interest there. But what really sets Withings devices apart from what's typically used in a B2B program is, in the past, it was sort of just like, get this patient whatever the cheapest thing possible is. Since a lot of the time, as you mentioned, that cost is absorbed by the program, or the device might be provided through an FQHC, they would just try to get the cheapest one possible. When Withings expanded to the B2B market, we really wanted to take on that mission of patients are consumers too. They deserve to have a nice, easy to use longevity device. So where Withings really sets apart is we have 100 or so engineers working on devices at all times. We have a huge research team. We have a medical affairs team. We have all of these teams built out to be thinking about what is the future of devices and how do we make them as validated as possible. So we have internal teams that actually work on these trials to get that validation, which is why we were one of the only cellular blood pressure monitors to have that validation on our BPM Pro, because it takes a lot of time. This is years and years of studies, of validation, of making sure you're looking at lots of different types of patients, not just one type of patient. So that's something I'm very proud of at Withings, that we aren't just looking to provide the cheapest thing that already exists. We're really looking to challenge the status quo and make sure that we're providing a in-depth medical device that can give clinical outcomes that care teams can trust and really rely on.
That's exciting and very helpful to get that insight. I know we're always so honored to have Dr. Bachman here with us, and I would presume that's something that's major, right, in the minds of your clinicians. Would you like to maybe give a little bit of reflection on your thoughts as it pertains to these sort of the policies that Catherine has referred to, and the process and procedures that manufacturers like Withings is taking for their devices?
Oh, absolutely. And I think that the more we can provide, we're promoting wellness rather than saying, okay, Gloria Bachman, you have horrible blood pressure or whatever, once it's been going on for 5 years, that we're nipping it at the bud and we're really doing something to preserve wellness of an individual rather than treat disease. And I would really hope that our government saw that, just like we see here at Match, that it really is about keeping individuals healthy rather than denying them services that they need to keep healthy, and only once they have the disease you're treating the disease. So all kudos. And just one other announcement for those who are in New Jersey. I know not all of you are in New Jersey, but we will have an OBGYN meeting in Asbury Park on May 9th, and I'll be there if anybody can go.
Love it. Thank you so much for sharing that. And Sadie, we have a question coming in from Stacy, a very good one. Stacy, you're here, but I'll speak your words for you if you don't mind. You have listed here. You had a question about how do you do the unveiling? What's the plan for unveiling this technology in the communities, so that they know that it's available, and how they might go about accessing it? What are the plans?
Yeah, great question. And so this is a device specific for our B2B population. There will be a version of it available for consumers, but this one that has the two-way interaction that really focuses on that care team interaction is for our B2B partners. So we kind of have two different verticals within our B2B systems. We work with clinicians, health systems, providers, FQHCs. So any of those care teams that are providing a remote monitoring program, it could be a traditional fee-for-service RPM, or we're expanding a lot more into the value-based space, which is exciting and a whole nother topic. But we do work directly with care teams, providers, clinicians, FQHCs, and they give these devices to their patients to be able to track that data in near real time. And we also work with digital health programs. So think about like an employee wellness program or a chronic condition management program, CHF, hypertension, kind of all of these heart-related conditions. There are definitely some maternal health programs that people would sign up for and be provided a Withings blood pressure monitor as a part of that process, where they're tracked for around a year on the device. So kind of the two verticals, one being the more business aspect of a digital health program, maybe provided through a payer, through an employer, or a direct to consumer program. And then the other half, which is really focused on those clinical settings, remote monitoring.
Wow, I just love that the variety in that, right? That you're kind of spanning all ends of it. Of course, being on the board of the Preeclampsia Foundation, the Cuff Kit program is the one that comes, direct to mind for me. And I just think like, wow, the opportunities for collaboration. And I presume that is something that I'm not speaking necessarily to that particular program, but just broadly speaking, that Withings is also interested in is having the opportunity to collaborate with organizations, non-profits, and others. Is that something that your team is open to?
Absolutely. Yep. We absolutely have multiple use cases for our devices, whether it's a for-profit program, an FQHC program, a grant-funded research, something that we work on together. We're absolutely open to all of those collaborations. We really want to try to grow this space together.
That's wonderful. Well, we can't thank you enough. And Catherine, we can't thank you enough either. Again, we love the work that the CTA is doing, how meaningful it is. I love that you pointed out that there's in fact more than CES, right? You have meetings, programs that are going out throughout the year. Do you want to maybe give a quick shout out to that as we close off today's program?
Yeah, definitely. We have a lot of events going on throughout the year. I am planning 4 congressional Hill briefings with the Digital Health Caucus. We also will have our Health Future event coming up in Boston, April 29th through May 1st, I believe. And then we have our Health AI Plus Symposium in the fall here in DC. And then, probably a lot more TBD as they come up. But yeah, as a CTA member, you will find out about all of those great events and more.
Yeah, the networking alone just blows you away, honestly. Like everyone else, my schedules are really like chaotic and tight. And I think Kelsey knew I was like in, I don't know, 3 or 4 cities, and it was like in in 2 or 3 days. But my must attend, I was like, come hell or high water, I'm going to make it to CES. And just attending the networking session alone, the digital health networking, gave me so much on my plate to get done. I have so much, it's all about the follow-up, right? And I have so much follow-up just from
Yes,
that little bit of time.
we had more than 800 attendees at our digital health
Yeah.
mixer at CES this year. So I'm glad you had a good time, Fran. I didn't see you. I was in the hallway being like, this way, no, you can't come in. No, you can come in. And people are like, no, we want to be in the room. And I'm like, it's a fire hazard. I literally can't let you in. I don't know what you want me to do.
I got in early. I was like, you know, the things you want to attend. AARP's program is one, and the
Yeah.
Digital Health Network is the other. And if you plan to get into those events, you literally have to like show up 30 minutes beforehand, like, because otherwise the line is like out the door and you won't be able to get in. So it's incredible.
Yeah, it is funny.
Yeah.
People are like, can you sneak me in? I'm like, no, like, I can't.
Well, kudos to you both. Thank you, Sadie. Thank you, Catherine. Thank you so much for being with us today. And we continue to your participation and everyone's participation. Remember, every third Thursday of the month, although, ding, ding, we have an announcement. Come March, we are actually going to be live in Las Vegas for HIMSS Global. Yay, HIMSS 25 is coming up and we will be there. We'll be hosting an event. It will be hybrid, which means you'll still have this forum like we have today alongside those who are going to be live there at the event. So a little change in the timeline. So for March, we are going to be meeting on March the 4th. Thank you. March the 4th, but still at the same time at 11 o'clock. And Kelsey will make sure that everyone gets that update. And then we will do a replay on our regular standing meeting time. So for those who missed it, they can still pop in and we can still chat a little bit, but it'll be informal for the third Thursday of the month. Because again, we're meeting on the first Tuesday. I keep saying Thursdays, first Tuesday of the month this time around. If you have any questions on that, please reach out to Kelsey and be looking out, watch your inbox because more details will be following this week. All right. See you all. Hope to see you at HIMSS and have a great rest of the day. Bye, everybody.
Ditto. Bye-bye.
Bye.